This is the largest COVID care centre in Bengaluru, a potential of 10,000 beds here at the Bengaluru International Exhibition Centre, which has been converted into a COVID care centre. Joining us, Dr Suresh Krishna. He is an MD physician assigned here. How does it work medically? How does the admission process happen? What happens here?
Actually, the vision of government is to take care of large number of COVID patients who turns positive, but they don't have a facility at their home.
Yes.
Where they can take care of themselves, where there is a separate toilet, separate room,
Yes.
where they can quarantine themselves according to the guidelines. So those are the patients which we call them here, and we'll take care of them.
Right.
And mostly they are asymptomatic.
Asymptomatic patients.
Yes,
Okay. All right.
Yeah.
So there would hopefully be no emergency here in terms of oxygen requirement, ICU requirement. It's basically keeping them in isolation and healthy.
Emergency facilities will
Are
be
there,
there, but the focus is to take care only of asymptomatic patients.
Okay. And what is the procedure when the patient comes in? How are they assigned here in the first place?
Once the screening has been done elsewhere in the city, like in BBMP hospitals, fever clinics, private hospitals, and in some private clinics, and once they turn positive, the BBMP officials will contact them, and they will call the war room, wherever the COVID care centers are vacant. Then they bring the patient here through the ambulance. Then there will be a triage area where the doctors will check whether this patient is symptomatic or asymptomatic. Once the patient is classified as asymptomatic, we'll take them in. According to the CDC guidelines, we'll treat them whatever the medications prescribed. For the 10 days, we'll observe them. Then after the 10th day, we'll discharge them.
For doctors like yourself, it is more than a routine work that you're doing. There must be a lot of extra tension, a lot of extra learning that is going on right now. How do you cope with it personally?
First of all, we are seeing this pandemic after 100 years. Not even our seniors, not our professors, not in our textbooks, they have discussed this. First time whatever we're facing, when I went inside wearing a PPT kit, when I did a duty in Bangalore Medical College, it was a totally new experience. Wearing those dresses for 6 to 8 hours, not going for a regular natural calls, not taking food, taking the torture and facing the patient. This is from the medical side. Next side is patients. There is huge stigma in the society. Like once you turn positive, whether you're educated or not, they're worried whether they sealed down the house, they're worried about their status in the society, they're worried to go to test also. These are all new scenario which we are facing. This generation of medical professionals, they're facing that. One more challenge is lot of healthcare workers are also dying around the country. So all these challenges make more complex situation. But what I suggest the patient is patient should not fear. The disease is not a curse. We should face the disease as a disease. It's just a disease, and once we pass through this phase of pandemic, once there is a vaccine, there is a proper medicine, the intensity of fear and the confusion will come down.
Absolutely. What is your duty like here? Do you have to stay here for a certain number of days? How does it work?
We as a doctors, those who are posted here, they work round the clock. There are 3 shifts.
Always on.
There are 3 shifts, like 8 hours. So 3 to 4 shifts will decide, and those doctors, they will be supported by the nursing staff. They will they'll check the vitals, and they will see to the medication whatever prescribed according to the CDC guidelines, it is reached them. Once the patient becomes sick or serious, we'll contact the nearby corona treatment centers. Then we'll refer the patient from here.
And do you have to stay here, or do you go home and come?
We have to stay 24/7. We have to be here.
For a 2-week stretch, or how long is it?
It's usually 10 days stretch and 4 days of quarantine.
10 days here, 4 days.
4 days at the end of the test duty, they'll do the test and they'll release us.
And there are enough doctors and nursing staff here?
Yes, madam.
Thank you very much for your work that you're doing. Thank you very much for helping out the people here.
Thank you.
A doctor here at the COVID Care Centre, the biggest in Bengaluru, talking about what it's like as a doctor with this new novel coronavirus, the challenges here, and what is actually going to be done here at this massive COVID Care Centre. With GM Kumar, Maya Sharma in Bengaluru for NDTV.